Hi, this is Dr. Greg Guyman. I want to talk to you about one of the things we do at very young ages. I talked about we like to see kids at 7 or 8 and for their first orthodontic visit. That's what American Association of Orthodontics recommends. That's what I recommend. But one of the most common things we will do on a 7 or 8-year-old is we use expansion. And we use expansion to widen the dental arches, widen the upper teeth, widen the lower teeth. Now, the reasons we'll use expansion is for severe crowding, number one, or for posterior crossbites, where the upper jaw is not in balance with the lower jaw, where it's too narrow compared to the lower jaw. And so for those kids that would really benefit from a wider, more broad smile, we like to use expanders. And this, again, isn't for everybody, but for those kids that would benefit from it, 7 or 8 is the perfect time to be doing this expansion. Now, the reason I recommend around age 8 is by then, patients have lost their front, upper and lower 8 teeth, okay? And so we've got a real good feel for what's going on both in their bite in the back and what's going on in the front. Now, one of the most common problems we need to fix is what we call posterior crossbites, where the upper jaw is too narrow compared to the lower jaw. Here's a perfect video of one of the things we use in these kids at the age of 7 or 8. This patient actually had a narrow upper jaw. It fit inside the lower jaw. And we use what's called the rapid palatal expander. Very common device. It's more comfortable at this young age. The correction is more stable at this age. And we also prevent some other additional problems. We help the teeth become straight. We help the teeth come in straighter, the remaining teeth come in straighter. And we more comfortably correct a crossbite. You can see the difference. A narrow upper jaw versus a wider upper jaw creates room for the rest of the teeth to come in. It also creates a wider smile. It's a more stable result when we do it early. So this is something we always like to fix early, is when the upper jaw is too narrow. We also use something called a lower expander. And the lower teeth are the ones that come in really crowded. And so when those young kids come in and their lower teeth are so crowded, and they have a facial profile that we don't want to take out teeth on, which is most kids in our practice, we like to widen that lower jaw sometimes as well. So a lot of times we'll use an upper expander as well as a lower expander. And so I'll show you a lower expander here. So here we have a perfect example of a young 8-year-old, very crowded lower teeth. There's no room for anything else to come in. And a lot of people wonder, well, should we start pulling teeth or what should we do with our son? Well, a lot of times we'll put in a lower expander, and that lower expander widens that lower jaw. Now, almost always when we use a lower expander, we also use an upper expander. And again, this is to give that broader, more full smile. And this isn't for everybody, but for a lot of young kids who have this severe crowding and a facial profile that will look better with a wider smile, that's where we use these upper and lower expanders. So perfect situation for a 7, 8, 9-year-old for that early interceptive treatment. Now, we can't use this expander at older ages. It's not as stable, it's not as comfortable. So we like to do it while the teeth are still erupting. So that's one of the biggest things we do at that 7, 8, 9 age.